family, it's Nurse Becca. I just want to do a quick video to go over everything with the COVID measures and the guidelines. I've been getting lots of questions. Thought this might be the easiest way to explain some things. So the first thing, thank you for everyone's patience. I know it's frustrating and it's a trying time. I appreciate your patience and understanding as we go through measures that we've never had to go through before. There's myself that's here full time, and Nurse Erica, she's not here tonight, but she is here from 7 to 2:30, so we do have a nurse in the district every hour that the kids are here. So some vocabulary to go over. This is strictly from the Warren County Health Department. Positive exposure. According to the Warren County Health Department, positive exposure to someone that has tested positive for COVID-19 is when an individual is in close contact within 6 feet with or without a mask for longer than 15 minutes with a person that has tested positive. Isolation. Isolation occurs when an individual has tested positive for COVID-19 and the individual must be in isolation for 10 calendar days. So how that works is if they start symptoms on Sunday and they are tested on Sunday, their 10 days doesn't start till Monday. So you would go 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. 10 full days, and they could return on the 12th. So that's how that works. As far as quarantine occurs when an individual has been directly exposed to an individual that has tested positive for COVID-19. The individual must quarantine for up to 14 calendar days. So that goes back to a positive exposure. So once that person goes into quarantine, it's because they've been around someone that has tested positive. So again, similar to the isolation, if the last exposure date was on the 1st, your quarantine starts on that Monday and goes for 14 days, full days. So 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14. They return to regular activity on that Monday, the 16th. So it has to be that full 14 days. A lot of people get confused because it starts with last exposure. So if somebody was at school on Friday, they got sick on Saturday, and they tested positive, we go back 48 hours for contact tracing. So again, just because you weren't with the person on the day they started symptoms, we start contact tracing 48 hours back. So if a kid was at school on the 6th, they got sick on the 7th, and they tested positive on the 7th, we would go back 48 hours. So anyone that he was in contact with within 6 feet for 15 minutes, on the 6th and the 5th would have to quarantine for 14 days. So how we are doing that at school, we'll get a call. This student body was sick and tested positive, and we need to start contact tracing. So we go back 48 hours. We use our classroom seating charts and our cafeteria seating charts. So if the person that was positive sits here, anyone that's within 6 feet in the classroom, obviously they're together more than 15 minutes. The classrooms are getting space in between the desks, but it's not 6 feet. So these individuals here would have to quarantine for 14 days. So you can see the students on the other side of the classroom are not going to have to quarantine. As far as cafeteria, if a student sits here, these students are going to have to quarantine. Okay? So that's how we decide who is going to quarantine when we get notification of a positive case. As soon as we get a positive case, we notify the Warren County Health Department. We are sending letters out as a district with those dates on when you can return. The county assigns a contact tracer through the county, but it's taking them 2 to 3 days to contact the person that was positive and find out who those contacts are. So that's why they're asking the school districts to start that process for them and to start the notification process. Once a student comes back out of isolation or quarantine, they need to check in with the nurse's office on the very first day. So on the 16th, when they would return to school, they would come to the nurse's office first thing so that we can review that they've been symptom-free, that their quarantine dates are over, and go over anything any concerns or any questions they may have. And then we also let the staff know. The biggest question we are getting to is when we put students in quarantine, if they go get tested and they test negative, can they return to school? Unfortunately, that does not shorten the quarantine period, because the quarantine period is the 14 days, because symptom onset can start from 2 to 14 days from the time of exposure. Getting tested for COVID. So if you have a student or somebody in the family that is symptomatic, so they have a fever, cough, shortness of breath, severe headache, stomach pain, runny nose, congestion, sore throat, all of those things are symptoms of COVID. If you have multiple symptoms, 2 or more, for the health department, we would recommend that you see a physician. If they decide to test you for COVID, anyone in your household should isolate or quarantine until you get the results back. So in the school setting, that would be if you have 2 kids in the household. So kid A gets tested, kid B should stay at home from school as well until you get the test results back. And then you can call myself or call Erica and we will give you the okay to return once we get a copy of those results. Now, as far as sending the kids, when we see the kids in the clinic, we're going over those same symptoms with the kids. If they've had any contact with somebody that's been sick at home, if they've traveled, going through those list of questions. If they have 2 or more symptoms, unfortunately, we do have to send them home. We are recommending they need to go to a physician to get cleared before they return to school. That is the guidance from the health department. We don't have a lot of leeway on that. There is a lot of kids being tested throughout the whole county, so that is our recommendation. If we have 2 or more symptoms of any illness, the students need to be evaluated by a physician before they can return to school. I'm not saying they have to be tested, but the physician will make that decision once you take them in and get them evaluated. Chronic illnesses. So that makes a big difference when we're seeing our kids in the clinic. If your kid has seasonal allergies and he's taking medication for us, if we get documentation of that, obviously we know that runny nose and that congestion might be from the seasonal allergies, and that helps us make that decision. We would not have to send that child home. If you have an asthmatic child that gets that chronic cough in the fall and winter related to their asthma, we will not have to send that child home related to that illness if we have documentation of that. So if you have not already submitted that to us, get that to us as soon as possible. Last but not least, if you have questions or concerns, please call us, email me. We will get back to you as soon as we can to help everyone be comfortable with everything that's going on. I know it's really hard. We are sending kids home more than we normally would have in the past, but we have to be extra cautious so that we keep everybody safe when we get to stay in school. Thank you. Have a good night.